Bismillahir Rahmanir Rahim. Wassalatu wassalamu ala Sayyidina Muhammad wa ala alihi wa ashabihi ajma'in. Assalamu alaikum wa rahmatullahi wa barakatuh. I thought I better jump up onto the stage before I get ambushed some more. Can you all hear me okay, first of all? Ladies at the back, hands up if you can't hear me. It's just a joke. Just a joke, don't worry. I'm sure you can all hear me fine. Jazakallah khair. So before I get into what I've been asked to speak about, can everybody please take out their phones? Right. Open your phones to your notes page and note down 5 takeaways from Maulana's talk. I'll give you time. Note down 5 things that you took away from Maulana's talk, because that was a really, really excellent talk. So please, I'm going to give you time. I'm genuine serious. I'm not saying I'm putting the mic down. I'm going to give you 1 minute to note down 5 things that you took away from the talk. But people still looking at their phones, that's good. Good, a few more faces looking at me now. Good, mashallah, jazakallah khair. It's very important when you come for events like this. I tell this to my students when I teach, actually. That, you teach a class, it's an hour long, an hour and a half long, sometimes my classes are. And most of the time, we won't remember very much about what was spoken about. And I tell my students who come to me weekly, I say, at the very least, note down 5 things at the end, right at the end, as soon as it's done, note down 5 things, the immediate things that you took away. It doesn't have to be a summary of the whole thing. Right? But it has to be 5 things that you took away. If you do that every week, then at the end of the year, you will have 250 things that you've learned that you didn't know before. Now what you do when the second year starts is you keep doing that, but in the first week, you go over the 5 points that you learned in the first week of last year. In the second week, the 5 points you learned in the second week of last year, and so forth. And this is how you actually build your knowledge. This is how you retain the information. Because this talk was a very, very good talk. I know I haven't gone on to my topic yet, but there's a lot to take away from it. The first is about the difference between attitude and practice. There is a difference between attitude and practice, that you can uphold certain ethical values, but do so in a manner that attracts the patient and consoles the patient rather than drives them away. Because as you quite rightly said, people come to us in their most vulnerable states. I mean, imagine for a minute that you took your child to a hospital. Your child had severe anemia. And you're beside yourself, you're really worried about your child. And you take your child to the hospital, and the doctor that you see says, well, your child needs a blood transfusion, but I'm not going to give him one, because I'm a Jehovah's Witness. And I don't believe in blood transfusions. And then turns around and walks away. Imagine how you would feel in that circumstance. That's that person's moral value. That's their ethical standard. Now, we may not believe in that. We may not accept that as a moral position, particularly in the case of when a life is at risk. But that is that person's moral standard. And if you think at that moment that somebody would stand up and applaud, that you would stand up and applaud the doctor for the courage of their moral convictions, I don't think you know yourself very well. You'd be too worried about your child. If that doctor, however, said, I can't do this because it's against my religious values, but let me take you by the hand, let me take you to another clinician, let me make sure you're sorted out, let me do all the workups and the tests, because I can do all that for you, I'll get everything sorted for you, but this specific thing, I will hand it over to my colleague here. This is my colleague, introduce, okay, I hope everything goes well, and off he goes. God bless, and off he goes. And you might have a very different attitude about that person at that point. And the second thing is this question of non-conforming. And what do we mean by non-conforming? And is it our role to judge? The person who comes to you, the husband, the boy and the girl that come to you for contraceptives, is it even your role to ask them if they're married? Is it part of the consultation to ask them if they're married when they come to you for contraceptives? But if you refuse them contraceptives, are they suddenly going to have a Damascus conversion and say, you know what, we probably should just get married? Yeah, is that likely to happen? All right. So how do you approach the situations? Not easy, but attitude is a hugely important thing. And it is an entirely separate thing from how you practice. So it is said about the Prophet sallallahu alaihi wasallam, Imam Busiri said about the Prophet sallallahu alaihi wasallam, you wanted me to sing, right? So here it is. نبينا الأمير النهي فلا أحد أبر في قول لا منه ولا نعمي. There's the nasheed. Imam Busiri said that he is our prophet. He commands and forbids, but no one's yes or no is more beautiful than his. In other words, the Prophet ﷺ, even his no was beautiful. Even his forbidding of things was beautiful. His forbidding of things drew people closer to the faith that he was calling them to. And that balance between that moral standard and our compassion for the person in front of us, hugely important. So anyway, I won't go more on about it. The idea about the relationship between the ulama and the doctors, very, very important, right? I said at the conference, was it a couple of weeks ago now, I think, wasn't it? I said at the conference, that as a group of doctors, we should be really troubling the ulama. We should really be getting on their nerves, right? By asking really good questions. Okay? If you ask a bad question, you'll get a bad answer. You ask a simplistic question, you'll get a simplistic answer. You ask a nuanced, detailed, clinically referenced question, you'll get a nuanced, detailed, legally referenced answer. Okay, and that's happening. It's happening in the UK, it's happening in the US. There is a real growing field of bioethics in terms of the ethics of medicine, particularly given all these technologies we have at our disposal now. The question of gender surgery, and gender affirming surgery, or whatever it happens to be. These questions are real life questions, but they are questions because we can do them. We can do these things now. We couldn't do them before. Now we can do them. It's always been the way with human beings that we say, can we do it? And sometime later on, we ask, should we do it? All right? And the problem that we have is that we should be asking, should we do it? Before we ask the question, can we do it? We put the cart before the horse. So these are problems of technology. And the more medicine advances, the more you will find these biotechnology questions arising that need ethical guidance. We need ethical guidance on them. So I won't go any further into it. While I talk, it was a very, very beneficial talk. I hope you all benefited from it. But Bismillahir Rahmanir Rahim, Alhamdulillah, wa salatu wa salamu ala Rasulillah wa ala alihi wa ashabihi wa man wala. Jazakallah khair to the IMA here for inviting me and for the wonderful hosting actually that I've had from the IMA throughout myself and my family's time here. It's been really wonderful to meet mentors, old friends, make new friends, and to find ourselves among you and to engage in these very, very interesting discussions. I have been asked to talk about Islam and mental health, which of course as a psychiatrist and a religious scholar, it kind of sits in my wheelhouse. That's my thing. I wanted to know first, though, from the audience here, because you guys will have known that this was the topic. Is there anything specific that you would like to know about? Silence. Any burning questions? How many people working in mental health are here? Give me a hand. Let's have a hands up. Okay. There's like a table. There's like a table of shrinks over there. There's a handful of shrinks in the back as well. Is that right? Is that about it? Yeah. Okay.
Aren't we all closet psychologists?
Well, this is why I made the question quite broad. It was actually a trick question, because the reality of it is all of us are dealing with the mental health of our patients. And Maulana, you reference this. I mean, people come to you vulnerable, they come to you scared, and so forth. They are in a state of psychological distress. Nobody comes to see a doctor when everything is A-okay. Sometimes, patients will walk in and I'll say, oh, how are you? And they say, oh, fine, thanks, doctor. I said, okay, right, next patient. Clearly you're not, otherwise why would you be here? I sometimes tell my patients, with the best will in the world, I hope I never see you again. Because we want people to be healthy but the question here relates to what is health? What do we mean by health? All right. Now, often we in the medical profession, because it has become so technologically advanced, because we can peer into people's very cellular structure itself, because we can look into their bodies, literally look into the inside of their bodies, because we can repair things in these amazing ways. Health tends to reduce down to meaning the absence of tissue pathology, the absence of tissue pathology. When is someone healthy? When their tissues are healthy. When are they unhealthy? When there is a pathology in their tissues. So there are liver specialists here, and there'll be heart specialists and so forth. What do you define as health? Okay, when is a person healthy? They are healthy when they do not have tissue pathology. They are healthy when the organ is working in the way that it is supposed to work. But there is a broader definition of health. There is the concept of well-being. There's the concept of well-being. When is a person, functioning optimally? Right? What is optimal function for a person? I was talking to my brother-in-law, and I was asking him how he was, and he was saying, I went to the cardiologist recently, and he put me on that treadmill thing. He's an accountant, very senior accountant. He was put me on the treadmill, and, I did the 10-minute thing, and, the elevation gradually increased, and the speed gradually increased. And he said, I thought by the end of it, I was completely shattered. I was, out of it completely. And I thought he would send me straight for an angiogram. And he said, no. If you needed an angiogram, you wouldn't have lasted 2 minutes on the treadmill. Right? What was being tested here? Functioning of the heart. Is the heart doing what it's supposed to do, which is pumping the blood to the various organ systems around the body in such a manner that it can sustain strenuous exercise? Great. That's another meaning of health. So absence of tissue pathology, one meaning. Optimal functioning, second meaning. Third meaning, the absence of distress. And this is much more subjective. Now think about pain. Think about pain. Think about how often chronic pain conditions, there does not seem to be an organic cause for it. You can't really find what the cause is. This person is just in pain. They are miserable. Okay? A person who you say, well, look, there is no tissue pathology that I can find. All of your systems are working optimally, and therefore you are healthy. What is that person going to say to you? But I feel terrible. But I am in pain. I don't feel right. Is your reassurance that they are healthy going to help them or not? And how do you get them to a state where they are not only healthy, but feel healthy? They feel healthy. They feel well. Which of the definitions of health do you apply in your practice? Because these are three different definitions of health. And 70% of the time, they line up with each other. But 30% of the time, they don't line up with each other. So if you are aiming for a particular mark on the horizon, but your patient wants you to aim at another mark on the horizon, how do you reconcile these two things together in your own clinical practice? Now, where a lot of this really comes into sharp focus is in mental health. So I ask my psychiatric colleagues, what do you treat? I mean, what is it that we treat? Well, the mind. I said, okay, where's that? Show me the mind. Don't show me the brain. If you are showing me the brain, then you're a neurologist. If you're treating the brain, you're a neurologist, right? One of my patients once said to me, he said, look, I've come to see you, I'm feeling like this, I'm feeling like that. Look, I want to know what's wrong with me, but don't give me any of that nonsense about the mind and about how feelings. I'm not interested in that stuff. I want to know, what do you do? I said, I am a microneurologist. He said, what? I said, I deal with brain pathologies that can't be picked up on MRI scans. All right? And he kind of went, all right then, fine, okay, what do we do? And then I started talking to him about feelings and, and all of those things. But seriously, with psychiatrists, I mean, where is the pathology? Go on, ask me, I dare you. Ask me what causes depression. I don't know. I've been a psychiatrist for 20 years. I don't know. What causes schizophrenia? The exact pathological mechanism that causes schizophrenia? Don't know. Where's the tissue pathology? There isn't any. Is that person unwell? Oh boy, yes. But I don't know where the tissue pathology is. I'm treating the mind. I can't show anyone the mind. I can't point to it on a skeleton. So what am I treating? Is it about functioning? Okay, so let's leave the tissue pathology bit of health. Is it about functioning? Optimal mental functioning. Okay, fair play. What is the mind supposed to do? What is the function of the mind then? I don't know what, memory? Executive functioning? Decision making? Putting things together? Assimilating stimuli into a coherent narrative by which you can respond to the world. It's all of these things. It's all of these things. And so am I therefore treating function? Is function my definition of health? When your mind is functioning properly, then you are healthy. Okay, sounds good, right? So how do I assess if your mind is functioning properly? Well, absence of symptomatology. When you stop hearing the voices, you are no longer psychotic and you are healthy. When you regain the motivation to go back to work, to engage with your family, and so forth, you are no longer depressed, healthy. Is that how it's defined? Then we can do that? I tell my junior doctors, baby doctors, I say, look guys, it's really easy to be a bad psychiatrist. Right? Really easy. I can teach my auntie to be a bad psychiatrist, right? There's a group of drugs over there called antidepressants. There's a group of drugs over there called antipsychotics. There's a group of drugs over there called tranquilizers, right? Pick one. It doesn't matter which one. Pick one of them, give it to every one of your patients, and boom, you've treated them. Sorted. Symptoms are gone. Right? Easy. I say it's very hard to be a good psychiatrist. It's easy to be a bad psychiatrist. It's very hard to be a good psychiatrist. Because when you're a good psychiatrist, at the end of your assessment, you can write the screenplay for the biography of that patient, for the movie of that patient's life. You can write the screenplay. You don't just know how they have got to where they are or why they are where they are, but how they have gotten there. What were the steps along the way? What led them to this? I had a patient once who was chronic treatment-resistant paranoid schizophrenic. Had been on the ward for 18 months by the time I got there, by the time I arrived there. Untreatable. Every time you're getting somewhere, you come back the next week and she's gone mad again. That's a technical term. She's gone mad again, right? She's hearing voices again. She's this, that, the other. We tried all sorts of treatments, and there's every number of false dawns. 3 months in, I said, I don't think that the medication, what we're doing with medication, is matching her symptoms. I don't think this is working. And we went back and we spoke to her and really dug into the details of this. Turned out that she was chronically abused. She was 60. When I got there, she was 60 years old. When she was in her 20s, she had been married, she'd been chronically abused by her husband, by her husband's family, physical, sexual, you name it. She had been, all this sort of stuff. Eventually, she'd gotten out of that relationship, but she was still living in the same sort of area. And every time she heard or she met or, someone texted her from her former family, she was back into it again. She became unwell again. It turns out that the hallucinations and the delusions and all of these presentations were her trauma response. She didn't have a trauma response in the way of anxiety. She had a trauma response in the form of psychosis. And that there are various reasons for that, but her trauma response was this. As soon as we realized that, and we realized what the problem was, we realized what the narrative in that patient's life was, things turned around completely. Now we were able to deal with what the problem was. So functioning. And then, as I say, the idea of subjective well-being. Because the fact is, lots of my patients are functioning okay. I mean, there is a way of distinguishing in psychiatry between mild depression, moderate depression, and severe depression. So in mild depression, you have the symptoms of depression, but you are able to look after your family, go to work, do all of those things. You can still get up. You've still got some get up and go, effectively. Moderate depression is basically defined as exactly the same symptoms, but now you don't have to get up and go. It's now interfering with your work and with your relationships and that kind of stuff. And severe depression is where it's interfering even with your ability to feed yourself, take care of yourself, and so forth. That is actually how mild, moderate, severe are distinguished. In other words, on the basis of functionality. Is your mind able to do what it is supposed to do? And all of these things come back to this amorphous idea of mind. I've not mentioned the word Islam yet, have I? Right? That's mental health. What's the relationship between Islam and mental health then? Well, what's the word for mind? What do we mean mind? What is the mind? Where did the idea of mind come from? Right? Why do we have this notion of mind? It's only existed for about 150 years, the notion of mind. Before that, it was soul, spirit, ruh, nafs. The Arabic word for psychology is ilmun nafs, the knowledge of self. Even the word psychology, psychiatry, the psyche is the essential human self. It is what we call in Islam nafs, ruh, and so forth. The word mind strips the discipline of a fundamental dimension of human existence. The mind is the soul minus God. That's what mind is. It is the soul viewed without reference to God. The abd without the Rabb. Now, that word Rabb is important. Because what is the essential human reality? Well, it is literally spelled out in the very first verse of the Quran. Alhamdulillahi Rabb al-Alameen. What's the meaning of Rabb? I'm not going to get into the technical thorny details with Maulana here. The word Rabb has 6 meanings, according to some of the Mufassirin. But the one that we are interested in here, and you will see this if you look at the English translation, right? How would you translate Rabb al-Alamin? Lord of the worlds. Cherish. You come across that one? Cherisher of the worlds. Sustainer of the worlds. You come across these? Right? I do a tafsir class. And each week, I pick a different English translation. Right? I go through a different, I do a quarter of a juz a week. I go through a different English translation each week. Just to look at how different translators have translated the Quran and what translation choices they have made. And if you look at the opening of the Quran, lots of interesting things here, by the way. Like, for example, does your translation, your preferred translation, start right to left or left to right? Think about the Quran translation, not the one on your app. That's boring, right? The book that you have, the translation of the Quran that you have that you pick up off your shelf. Does it open like an English book? Does it open like an Arabic book? Ooh, that's a choice. The translator has made a choice as to, do you follow the Arabic direction or do you follow the English direction? And why is that choice made? Who is the intended audience? Because in the Muslim world, Arabic, Urdu, Persian, Turkish, when Turkish was written in the Arabic script, these were all right to left languages. You open the book like that. But when you're in the Western world, all the languages of the Western world, the Latinate languages, all the languages influenced by Greek, are left to right languages. If this was in China, and the Quran has been translated into Chinese. It was translated in the 16th century to Chinese. How do you think the book opened? Top. Because Chinese is written downwards. Okay? These are choices. What is the choice? How do translators translate Rabb al-Alamin? And I want you to think about this, because this is fundamental, that simple thing. The choice of the translation of the word Rabb fundamentally impacts on your relationship with God. Is He your Lord? Is He your creator? Is He your cherishing sustainer? What is your relationship with Allah? And if you go back to this, if you think about your relationship with Allah and how your relationship with Allah has developed on the basis of just the translation of the word Rabb. So what does the word Rabb mean in Arabic? Well, as I said, there are 6 meanings. But the one preferred by Imam Baydawi, who is the great, I won't go into detail, he was a great commentator of the linguistic subtleties of the Quran. Imam Baydawi said the word Rabb means Rabba, and Rabba means to grow. God is your grower. God is the one who grows you, the one who cultivates you. Like when we make dua for our parents, in the middle of the Quran, Rabbi irhamhuma kama rabbayani saghira. Oh Allah, have mercy on my parents, because they did Rabb of me when I was a child. They were my Rabbs when I was a child. They were the ones who nurtured and developed and cultivated and clouted me as well. Discipline is part of cultivation. This is where the idea of tarbiyah comes from. The word tarbiyah is to rub someone, not to rob them, to rub someone, right? To be a rub for a person. Okay? Allah tells us, Kunu Rabbaniyin. Or He tells actually the rabbis, same word, the rabbis of the Bani Israel, Kunu Rabbaniyin, be Rabbs. So the fundamental relationship between the human and the Lord between the human and their creator is one of cultivation. God is growing you. God is raising you. And when you remove that which is being cultivated, when you cut it off from the cultivator, what happens to your garden? Well, it grows wild. It becomes a place of thorns and brambles and weeds and swamps and marsh. This is what happens to the human when the human is deprived of divine cultivation. Why are there so many mental health problems? Why more and more? This is a question we ask all the time, usually when we're looking at waiting lists. In the NHS, psychiatrists. So I start laughing when people say, oh, you guys are just in it for the money. Boy, if I was in it for the money, I would want as many patients as possible. Right? But I'm not. I get a salary. If I get 1 patient a day or 15 patients a day, I get the same salary. I'm a government employee. It makes no difference to me. I would love people to have great mental health, but they don't. The waiting lists are worsening and worsening and worsening. We tell people in the UK now, oh, you need therapy. Great. When? 2 years' time. 2 years' time. Just stick it out for 2 years. Just hang in there, hang tough for 2 years. Then you get your 6 sessions of therapy. 6 whole sessions. Yeah? Why are the waiting lists getting longer and longer and longer? Why are there so many people suffering from psychological distress? The answer to this question is a mystery. It is a mystery to everyone in the secular science. We don't know. Right? But the people who combine the secular and spiritual, they know. The garden has become untended. Our gardens have become untended. They have grown wild. And instead of producing roses and tulips and, since we're in South Africa, proteas, they are producing thorns and brambles. Because we have cut ourselves off from the true source of our meaning, the true source of our purpose. So I don't want to go into a bayan. I meant to talk about Islam and mental health. But understand that at the core, at the very core of the entire field of mental health, there is a gap. There is a yawning chasm. And that yawning chasm is, what do we treat? Who am I? How do I understand the nature of the human? How do I understand the way in which the 100 trillion neural connections in here, the most complicated structure in the entire universe, understand this? Between the 6 inches of your cranium lies the most complicated structure in the entire known universe. We are ridiculously overpowered. If our only goal was survival, we wouldn't need to be more than single-celled organisms. Bacteria are doing fine, thank you very much. Bacteria are fine. They are single-celled organisms and they have survived for 1 billion years. They have not gone extinct. Why do we need such overpowered brains? What, to know the world? To understand habit? To find food? To procreate? All that stuff's done in your brainstem, basically. Yeah, okay, maybe slightly higher than the brainstem. What do we need such ridiculously overpowered brains for? Why do we need the ability to create civilizations and great art and music? What is this all for? Why do we need, for example, I remember we were talking to somebody about proofs for the existence of God, and had the whole evolution discussion, which I won't go into now, but we had the whole discussion about, what's it called? Evolutionary psychology. That's what it is. Evolutionary psychology. You can explain our psychology on the basis of evolution. We have evolved these higher senses and so on and so forth. That's okay, great. Why have we evolved a sense of beauty? Why do we have the capacity to appreciate beauty? Beauty is not safe, necessarily. Beautiful things can be very dangerous. And ugly things can be very good for us, which is why the medications that we prescribe often don't taste very nice, right? They are ugly things. They taste horrible, and yet they are very good for us. Whereas, let's be honest, sugar and all the carbs, all the heavy carb stuff. I was having a conversation with someone, I won't mention who, about mithai and malida and barfi and it goes on, and it goes on, and it goes on. It's like mouth-watering, beautiful to the taste, and really bad for you. Yeah? You carry it like this in your hand from the shop, and then you carry it in your stomach, and you carry it in your adipose tissue for the rest of your life. All right? No good for us, but it's beautiful. Why have we developed a sense of beauty? So understanding that at the core of mental health, there is a yawning gap. There is an explanatory gap. And that explanatory gap is the nature of the human. What is the human being? Because every form of psychology, whether it is Freudian, whether it is Jungian, whether it is about narrative or schema-based therapies, whether it is the latest one I heard about was body trauma work, all of these things make a supposition. All of these therapies make a supposition about what the human is and where, therefore, the human drives come from and what the purpose of the human is. In Freud's case, most of you will have heard of Freud, and you probably have heard of id, ego, superego, right? I mean, I won't pretend like I studied this. I skipped those lectures in my specialist training. But you've all heard this, right? Id is your primal desires. I want. Okay? Superego is what? Is your moral constraint. I can't have. Right? And the ego is you in the middle. Ego is I in Latin, right? The I in the middle. That is torn between the id, the desires of the id, and the demands of the superego. And in the tension between those two things, you experience psychological distress. And actually, pretty much, yeah, that's awesome. That's really good. That's a great description of the human being. But what is the superego? What is the superego? How is the superego constructed? Well, from a Freudian perspective, it is constructed from the societal imperative to conform. Since you were talking about non-conforming lifestyles, the societal imperative to conform. You must conform to a certain set of behaviors in order to be socially acceptable. That is the superego that is pulling in an opposite direction from I want, I need, from the 2-year-old inside you that says, gimme. Or, as the great philosopher Freddie Mercury said, I want it all, I want it all, I want it all, and I want it now. That's id. That's id. Now, it's a very good overview of the human psyche. And we all know it. You know it intuitively that I want something, but I can't have it. I want it, but I can't. It's haram. From our perspective, it's haram. Right? I smell the guys, doing the non-Muslim guys doing the braai, and they seem to be having a great time with the castle lager, but I can't have it because it's haram. Right? Or other things. All right? We won't go into the details, but I'm sure I'll leave it to your imagination. It's a great idea, but it's lacking something. What it's lacking is, why do we want? And what is the nature of the superego? In other words, what is the nature of the id and what is the nature of the superego? In a Freudian mindset, and a lot of this has passed into the psychology as it goes forward. When I gave you a description of mild, moderate, severe depression, how is it defined again? It's about basically your utility to society. If you can continue to perform your role in society, you are not moderately depressed. You are at maximum mildly depressed, even if you wake up every morning with a clear plan about how you are going to hang yourself, with an absolute determination to end your life if only the opportunity were to present itself. That you are in a moment of agony that seems to stretch into eternity. Unbearable psychic distress that you can see no way out of. You are on a highway to hell and there are no exits. But you can go to work. You can pick up your kids from school. You can still make the biryani at Eid time. Yeah, guys, as you all do, as I know, right? You are not moderately depressed. Function in society from a Freudian perspective, right? The demands the society places on you. It's those unfair demands. You are a woman of a certain age and therefore this is what is expected of you. You guys have heard of hysteria, right? Ladies, you've heard of hysteria? You ladies get hysterical, right? Yeah, you'll get hysterical. This is why you're not allowed to go to the graveyards, right? Because you might get hysterical. Guys don't get hysterical, right? But ladies get hysterical. Do you know what hysterical means? What is the hysteros? It's the womb. Like a hysterectomy. It's a womb. It's the womb. It was felt that if a woman was, Freud said that hysteria is when a woman cannot cope with the demands of the society, that demands that society place on her, a woman specifically, cannot cope with the demands that the society places on her to behave a certain way, to act a certain way, to perform certain roles and so forth, because her id is pushing in another direction entirely, and the way that that manifests is hysteria. Is hysteria. From an Islamic perspective, what is the nature of the superego? What is the nature of the moral restraint that delimits our behavior? And what is the nature of the id that drives us? Islamically, we have a 1,000-year-old tradition of investigating these two concepts. A 1,000-year-old tradition. A 1,000-year-old medical tradition and a 1,000-year-old religious tradition. The religious tradition explaining not just what is the ruling, but what is the overarching principle of the Sharia itself. Why is the Sharia even there? What is the good that it is pointing to? Where does it come? From whom has it come? Through whom has it come? And therefore, what is its nature? What is the nature of the Sharia? The nature of the Sharia from Ar-Rahman through Rahmatan lil Alameen is Rahmah. It is Rahmah. The nature of the divine law is Rahmah. What do I mean by that? Every ruling in the Sharia, and this is legal theory, not 101, probably 301, Maulana, I would say, maqasid and so forth. Legal theory 301. You cover this kind of later on as you go through. Every element of the Sharia has a wisdom to it, and the wisdom points in a direction. What is the direction in which every ruling of the Sharia points? Preservations, certain preservations. Preservation of the human right to a spiritual life, to know God. Preservation of life and health. preservation of intellect and education, preservation of family and community life, preservation of wealth and that sense of social stability, social and financial stability, and preservation of dignity, of human dignity. Maulana was talking before about how, basically, to rephrase what you said, how to balance between the moral imperative which is, remember, the moral imperative is a desire to save that person's soul, to heal that person's soul, and the imperative to preserve their dignity, to preserve their sense of self-esteem. All of these are the ultimate goods of the Sharia. 5, 6, some of the ulama say, these points are what are called the maqasid al-Sharia. But that is not sufficient, because each of those 5 refers back to one principle. It refers back to one principle. And that principle is the removal of harm and the acquisition of benefit. That Sharia seeks to remove harm from human individuals and human societies in terms of their this worldly life and their next worldly life. Remove harm and bring forth benefit. Daf'ul mafasid wa jalbul manafi'. What is that itself? What is that reducible to in terms of a quality or a principle? What is that overarching principle of the Sharia? What does Sharia seek to do? Remove harm, bring benefit to individual humans in this world and the next world, to societies in this world and the next world. What is the principle? That is the principle of rahmah. Why? Because the definition of rahmah is to desire that good come to others. That is what rahmah is. Iradatul khair lil ghayr. To wish good for others. And rahmah is a characteristic of the Rahman. So the entirety of the superego, remember we started this, the Islamic superego fundamentally seeks your good, your health, your well-being. God does not see you instrumentally as a pawn in a great game, such that if you need to be sacrificed, then if you need to be sacrificed, so be it, because there is a greater good for the great and good in society. You are not a cog in a machine to God. You are precious to God. That is the principle of the Sharia. That is why the superego, when understood from a perspective that is bereft of divinity, the superego is a malevolent force. Understand that Freud is really the basis of pretty much everything that came after him. As much as CBT guys would like to say that we're not, but you are really. Sorry. Right. But the Freudian idea is what? The id is malevolent. It just wants to, eros and thanatos. I want to consume, I want to destroy. The superego is malevolent. It is, you are only worth as much as you can give to society, and you can fulfill that role in society. So you are surrounded by malevolence. There is malevolence within you, there is malevolence outside you. And what are you? You are the victim of oppression, the oppression of the id, and the oppression of the superego. How are you going to be happy, man? How are you going to find happiness in that? Yeah? What do we understand it Islamically? Islamically, the superego, inverted commas, the moral restraint, is the Sharia, is the divine guidance, and that is coming from Ar-Rahman, through Rahmatan lil Alameen, as Rahmah for you. You as an individual. We do not instrumentalize people in our religion. Okay, great. So what about the id then? So what is the id? Well, what is your id? Nafs. Oh, that darned nafs. Hang on a minute. What's the nafs? What's the nafs? The nafs, okay, doctors, the nafs at one level is your autonomic nervous system. Okay? Your sympathetic nervous system, fight and flight. Your parasympathetic nervous system, rest and digest. It is eros and thanatos, just like Freud said. Right? In other words, your nafs, you want to be a bit more neurobiological? It is your noradrenaline arc and your dopamine arc. Right? Enjoyment and fear. Desire and fear. What is the id? Let me rephrase it. The id is the desire to acquire what is beneficial and the desire to avert what is harmful. What does that sound like? Let's see if you've been paying attention. What does that sound like?
Sharia.
It sounds exactly like the Sharia. Hang on, wait a minute. That sounds exactly like the Sharia. The desire to acquire what is harmful and avert what is acquire what is beneficial and avert what is harmful. But that's the exact guiding principle of the Sharia. And by the way, this idea of what the Sharia is, you want a reference for this? Al-Izz bin Abd salam, who was the Mujaddid of the 6th Islamic century, who was known as Sultanul Ulama, right? The great scholar of the 6th Islamic century. He wrote a work called Al-Qawaid al-Kubra, and in this work he reformulated the entire Sharia around this principle. That's the whole point of Al-Qawaid al-Kubra, which I've studied, right? The entire Sharia, every ruling, where your pants have to sit below your ankles or above your ankles, how long your beard has to be, which order you trim your fingernails in, all that stuff, all this minutiae of Sharia. And he explains how each of those things build towards the ultimate goal, which is felicity, which is the ultimate good of this world and the hereafter. Okay? But your id wants exactly the same thing. It just doesn't know what is beneficial and what is harmful. That's all. The id wants what is beneficial to it, and it wants to avoid what is harmful to it, but it does not know what is beneficial and what is harmful. And where then the relationship between the superego and the id is the relationship of, back to the beginning of the talk, you're wondering where I was going with this, tarbiyah. The relationship, therefore, between the superego, which is the Sharia, and the id, which is your most basic foundational self, is that the Sharia seeks to teach you what is good for you and what is bad for you. This is why you will find things like the nafs is a horse and the aql or the intellect is the rider. Where does that come from, by the way? Galen, the great Roman doctor, Galen. The nafs is the horse. The intellect is the rider. The rider must control the horse. Galen. From Galen it passes through to Miskawayh. From Miskawayh it passes through to Raghib al-Isfahani. From Raghib al-Isfahani it passes through to the Mizan al-Amal of Imam Ghazali, and then to the Ihya of Imam Ghazali, and then into Islamic orthodoxy. Right? This idea is as old as human civilization. The human desire is not a malevolent thing. Your id, your nafs, is not a bad thing. If it were, then why does Allah talk about the nafsul mutma'inna? Not the ruhul mutma'inna, the nafsul mutma'inna. What is therefore then the nafsul mutma'inna? The nafsul mutma'inna is when the id, I want, I fear, has received the tarbiyah of the Rabb and has aligned what it desires and what it abhors with what God has demonstrated is actually in your best interests and in your worst interests. And because of that alignment, the psychic distress and tension of the ego goes away. And that is how you end up in a state of itminan, a state of tranquility. In mental health, I sometimes tell mental health professionals, you are doing God's work. And say, what do you mean? I said, well, Allah says, Innal insana khuliqa halu'a. Man has been created in a state of anxiety, in a state of restlessness. That's the beginning of our story. What is the end of our story? Ya ayyatuha nafsul mutma'inna irji'i ila rabbiki radiyatan mardiyah. O soul that has found peace, return to your Lord well pleased and well pleasing. You are taking people, and I say you, and I mean all of you here. All of you here. Whether you are psychiatrists, whether you are psychologists, whether you are any form of specialist, because you deal with people in distress, whether you are parents, whether you are spouses, whether you engage with anybody in your life, because al-mu'min ya'laf wa yu'laf. Because the believer is, you translated it as the believer is loving and loved. Loving and beloved. Yes. To who? To who? First, to God. The believer is loving to God, loves God, and God loves the believer. Al-mu'min ya'laf wa yu'laf. Then to those around you. But in another way of translating, ulf is connected via kindness. Connected via empathy. The believer connects to others via empathy. And empathy is to feel something of what they feel. To understand where they are coming from. And when you do that, you will receive it in return. Al-mu'min ya'laf wa yu'laf. Wa khayrun nas anfa'u lin-nas. And so the best of you is the one who is most beneficial to people. To do what? To take them from halu'a to mutma'inna. From anxiety to tranquility. From fear to safety. From restlessness to calm. That is what the Prophet ﷺ did. And he did it to everyone he encountered. This is our role. What are we therefore? What is the psychological reality of the human? God has provided us with an id that yearns for good and fears harm. That yearns for light and fears the dark. And has provided us with a divine way from a divine prophet, a divinely inspired prophet, that shows us the way to get to where our nafs has been created to want to reach. So that is one of many, many, many interconnections between Islam and mental health. Not just as a professional, but as a human. When you find yourself in a state of anxiety and tension and doubt and fear and so forth, ask yourself, I am a being that desires good and that fears harm. And I have a Lord, a Rabb, who is growing me to an understanding of what is good and beneficial and what is harmful. Where is the tension within me coming from? What is pulling me away from the magnetic alignment to the moral principle that has been revealed? Islam is intimately and integrally connected to mental health because it is a religion of fitrah. And another idea or meaning of what self is fitrah, your fundamental human nature. In other words, you were created with all the tools to traverse the journey to God. And all you need, you are a God-seeking missile. And all you need is the stars to navigate you so that you can break out of the orbit and travel, in the words of another great philosopher, to infinity and beyond. I'll leave it there, inshallah. Barakallahu feekum wa sallallahu ala sayyidina Muhammad wa ala alihi wa ashabihi ajma'in bi rahmatika ya arhamar rahimin.